Today should not be about me. Today should be about the future of trust in public health.
That is former CDC Director Dr. Susan Menares testifying before Congress at this hour about being fired from her job. She was sent packing just 29 days after taking the job and after disagreeing with her boss about vaccine policies. This week, a new panel is expected to vote on vaccine guidelines at the CDC. And joining us now is Dr. Amish Adalja, a senior scholar at Johns Hopkins and a spokesman for the Infectious Disease Society of America. Dr. Adalja, thanks for being with us as always. So let's just lance the boil. As someone that we talk to frequently during the COVID crisis, do you still trust the guidance coming from the CDC?
No, I do not. The CDC has basically been purged of individuals with scientific expertise and is now under the complete control of RFK Jr., who is an avowed anti-vaccine advocate for decades. And because of that, especially with what he's done with guideline committees like the Advisory Committee on Immunization Practices, it's really something where you can't trust what's coming out of it. It's become an organ of anti-vaccine propaganda.
I want you to listen to something that Dr. Menares said in the hearing. What she says the head of Health and Human Services, RFK Jr., told her. Take a listen.
He directed me to commit in advance to approving every ACIP recommendation, regardless of the scientific evidence. He also directed me to dismiss career officials responsible for vaccine policy without cause. He said if I was unwilling to do both, I should resign. I responded that I could not pre-approve recommendations without reviewing the evidence, and I had no basis to fire scientific experts.
She also told members of the Senate panel that she was told not to talk to senators. Is there a cover-up taking place, in your opinion, at the CDC right now?
Well, I think that RFK Jr. doesn't want to appear like he was influencing the CDC director to do his bidding, but that's exactly what was happening. And when the CDC director needed to talk to the Senate to talk about what guardrails were being violated, he didn't like that. And I think you have to recognize that RFK Jr. was sent to HHS by President Trump to do one thing, and that was to, quote unquote, go wild on health. And he's been dismantling the entire vaccine ecosystem in the United States. And that's why he needs people that are going to do his bidding at the CDC, that are just going to ratify what his hand-picked anti-vaccine advisory council actually says to do. And if you have any kind of opposition to that, if you actually want to stick to science and reality, you have no place in RFK Jr.'s HHS. And that's what we're seeing with Susan Menares right now, that she is a victim of that cycle that RFK Jr. has put into place.
So let's talk about patients. When your patients come to you and ask about vaccines, say, for instance, the upcoming COVID shot, where do you direct them for guidance?
I try to give them my own opinion on what I think they would require as an infectious disease physician. I think I have expertise, so I can help guide them in those decisions. If it's a child, I also will have them look at the American Academy of Pediatrics guidance. The Infectious Disease Society of America is going to have guidance coming out soon. So there are alternative sources that are vetted, that are based on scientific data, that are going to become available in the coming weeks to help people guide themselves through this kind of confusing maze that RFK Jr. has deliberately constructed, because you can't trust what the ACIP is saying. You can't trust what they're going to do tomorrow. I think most of us are cringing to see what's going to happen tomorrow. And you have to also think that the FDA and NIH are also very compromised because they're all beholden to RFK Jr. and his ideology.
Are you afraid that lives will be lost or diseases like measles that were once thought to be eradicated will return?
They've already returned. We're in a banner year for measles. We've already had 3 Americans die from measles in the United States. That's unheard of. So measles is already on pace to possibly get us to lose our elimination status. We're seeing high rates of pertussis. We had record numbers of pediatric influenza deaths last year. So we are in a position where many of these diseases are coming back, and what's keeping them at bay, even to some degree, is our vaccines. And if you see further erosion of our level of vaccine protection, especially in high-risk individuals, we will go back to the bad old times when these diseases were very disruptive, took a toll on children and high-risk adults, and also created much disruption in schools and workplaces. That's the future that RFK Jr. has in store for us. That's the future he wants. That's the future he's setting up to occur.
Let me flip the script for a second. Why shouldn't people believe that this isn't just an entrenched medical hierarchy trying to protect the old way of doing business and pushing back against change?
They should just open their eyes. All of us just went through the COVID-19 pandemic. You can remember what it was like in December of 2020, January 2021, when every hospital in the country was basically busting at its seams, not having enough ventilators, not having enough personal protective equipment, what the wait times were like in the emergency department, hospitals that could barely function. That's not the case anymore. What changed? High-risk people started getting vaccinated. You can look back to what your grandparents or great-grandparents, what their experience was with measles, and how many children that they knew died of measles or were hospitalized against measles. And that's not happening anymore, or hadn't been happening for some period of time. What changed? Vaccination. So the evidence of the efficacy of vaccines in improving all of our lives is plain to see. You have to actually evade it the way RFK Jr. does. So it's not some entrenched way of doing things that's severed from science. It's actually based on science and empirical data of how things got better for humans in this country. So I don't think it's something that's a biased way of thinking or, as you said, entrenched or just something that people are kind of stuck doing. It's actually based on evidence and based on results.
Final question before I let you go. I only got 30 seconds left, but we do not operate in an island. COVID taught us that what happens in one country affects us all. Are you worried that our foreign enemies who do research into bioweapons, et cetera, might be looking at this institution, the CDC, that used to protect us, and saying this now would be a good time to attack us?
Certainly, because if you think about a biological weapons attack, what are you going to use to counter it? You're going to use vaccinations. You're going to use public health communications. That's completely broken in the United States right now. Nobody trusts the CDC. You have RFK Jr. ending mRNA vaccine research by HHS, which some of that was focused on biological weapons countering. So we're in a very vulnerable spot when it comes to biothreat agents. There is nobody in the Office of Pandemic and Public Health Response in the White House right now. So yes, I think we are very vulnerable from a biosecurity standpoint. And this is one of the sad cascading impacts of RFK Jr.'s impact. It is sending a whole chill down the entire field.
Dr. Amesha Dalja from Johns Hopkins Center for Health Security, a trusted voice on this and many broadcasts during the COVID pandemic. Dr. Dalja, as always, thanks for being with us.
Thanks for having me.